Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you for joining us for FYI, the Quincy Health Department, a program that looks at various health issues and topics and helps you to stay healthy and informed. Joining me, as in programs past, is Caitlin Pico. She is a public health nurse here in the city. Caitlin, welcome.
Thank you.
I should say welcome back.
I know. Thanks for having me again.
Oh, you're welcome. I do hope that you continue to come into Quincy
Yes.
Access Television and kind of educate me and educate the folks at home on a variety of topics.
Yes, absolutely.
Today, we will be talking about strokes.
Yeah, so this is a very good topic for everyone to be aware of because anyone can really identify these symptoms. And there is a time crunch when the symptoms start in order to get proper treatment. So I just want to educate the public on this.
Very good. And educate, well, I'm part of the public too, so
Yeah.
educate me as well. Let's go over the outline for today so folks know what to expect. We will talk about a stroke as far as we will give a definition of a stroke, types of strokes, risk factors, symptoms, treatment, and effects of a stroke, and lastly, prevention. So again, always great to start by defining what we're talking about. So a definition of a stroke.
Yes. So a stroke is considered a disease that affects the arteries leading to and within the brain. It is the fifth leading cause of disability in older adults in the United States, according to the American Stroke Association. I will refer to that a little bit throughout this presentation, so I'll call it ASA from now on. But a stroke occurs when a blood vessel that is traveling to the brain is either blocked or ruptures, which leads to a lack of blood and therefore a lack of oxygen to the brain cells, which can cause cell death.
It's the lack of oxygen.
Yes.
Now we do have an image that will be on screen momentarily, I believe.
Yes. So this image is kind of just an overview of what a ischemic stroke might look like. It just shows an obstruction in the vessel. So under types of stroke, there's two major ones. The first is the ischemic stroke, and this occurs when a blood vessel is obstructed, and the main cause is arteriosclerosis. In this condition, there's fatty deposits that line the vessel walls. And these fatty deposits can cause two types of obstructions. The first, we have cerebral thrombosis, where a blood clot develops within the blood vessel. And then the second one is cerebral embolism, where the blood clot forms in another location in the circulatory system. And a common location when embolism may form is in the heart and the large arteries in the upper neck and chest. And one main condition you may see them form in the heart is with atrial fibrillation. Because of the irregularity in the heartbeat, the clots form in the heart and then they are dislodged out of the heart and they travel to the brain.
Because of the irregular heartbeat?
Yes.
Okay.
Yes. So I will go under that under risk factors, but it's important to manage any medical condition you have that
Sure.
puts you at risk. And then it's important to know ischemic strokes account for approximately 87% of all strokes that occur.
And those are folks will be able to relate when the term clot is used,
Yes.
correct?
Yes, clots are the big main word for ischemic stroke.
Okay.
You would think of a clot. And then the next one we have is a hemorrhagic stroke, which is the main word for this would be bleeds, you would think of. And then this type of stroke is caused by a weakened vessel that ruptures and bleeds into the surrounding brain. And this blood can then accumulate and compress the brain tissue, causing cell death.
Yeah, I've heard of a brain bleed, so this would be it.
Yes, because
Okay.
you're worried about the pressure increasing.
Yes.
So and there's also, you're not getting the proper oxygen to the brain during this bleed also. And there are two types, which include intracerebral hemorrhage, which occurs within the brain, and then the subarachnoid hemorrhage, meaning the rupture occurs in the space surrounding the brain. But either way, you're worried about the compression with the pressure. And then two types of weakened blood vessels that usually cause this type of stroke include an aneurysm, which is very well heard of. A lot of people know about an aneurysm. And then arteriovenous malformations can also occur. And then we have, next there's a brain stem stroke. And this has complex symptoms, and it's very difficult to diagnose in most circumstances. So these symptoms may include vertigo, which is dizziness, and severe imbalance without the hallmark sign of most strokes, which you would think of weakness on one side of the body.
Right, right, and we'll kind of go over those as we talk. But so with that said, it's probably one of the most dangerous, especially if it can't be easily diagnosed.
So with any type of stroke, whenever these symptoms occur, you want to get prompt treatment. So even with a brainstem stroke, it's important to know that dizziness alone does not indicate a stroke.
Okay.
It's when it is combined with that severe imbalance. In all these stroke symptoms are the sudden onset. So that's, if you ever had a sudden onset, you would want to contact medical help right away. And then with this brainstem stroke, the individual may also experience double vision, slurred speech, and a decreased level of consciousness. And then next we have a cryptogenic stroke, which just means that there's no determined cause. So in this case, further testing is very important to determine the definite diagnosis. And to prevent recurrent strokes, collaboration by neurologists, cardiologists, and other specialists may be necessary. And then the last one that I included on this slide is TIA, which stands for a transient ischemic attack. And this itself is not a stroke, but it is referred to as a mini stroke. And what a TIA is, it's a temporary blockage of blood flow to the brain, which does not cause permanent damage. And since these symptoms resolve, many people don't think to get medical attention after, which is a big mistake, because a TIA can be a signal that a full-blown stroke is in the future.
Okay.
So if you were to get any symptoms of a stroke and they relieve, still go get medical help.
Right, because something isn't right.
Yes, yes.
I never realized there were that many types of strokes.
Yes, the two main are the ischemic and the hemorrhagic stroke.
And they all deal with obviously a blockage and lack of oxygen.
Yes.
Now we will look at risk factors, and this is actually separated into two categories. One that you have titled out of the individual's control, and then there are some manageable conditions.
Yeah, so there are a couple that the individual, I'll go through those ones. It's really aspects or characteristics of a person that you just inherit. There's nothing you can do about that.
There's nothing you can do about the first one, age.
Yes.
You age, we all age.
So I'll just let's go through these. So as you said, the first one is age. And it's important to know that at any age, somebody can experience a stroke, but the likelihood increases the older you get. And strokes are more common in individuals over the age of 65. And then next we have family history. Your risk increases if a family member has had a stroke, especially if they were younger than 65. And it's important to know that there are genetic disorders that put you at risk for having a stroke. So with many conditions, you want to be aware of what your family history is, if possible.
And you certainly want to communicate that with your doctor.
Yeah, so if one of your relatives or parents had a stroke, you want to mention that.
We should note that often when folks go for, let's say, a yearly physical, the doctor will sit with the patient, and at least close to maybe half of the exam is really dedicated to taking information from the patient. So you really need to be, I suppose doctors aren't magicians, so you really need to kind of fill them in, correct?
Yes, because they're only going to know as much as you tell them. So it's important to, even if you can, talk to your family members, see what conditions maybe your grandparents had.
Right, because you might not be aware.
Yeah, so when you sit down with your doctor, you're prepared to give them all the most amount of information that you can give.
So, getting back to our list, race.
So according to the ASA, African Americans have a higher risk at fatal stroke than Caucasians do. And also Hispanics and Latinos also have unique risk factors. And the increased risk for a particular race is also associated with, in some of these races, you may see a higher risk for hypertension, a higher risk for obesity and diabetes. So I'll get into that when I do the following risk factors. But that's kind of what puts them more at risk. And then next we have gender. Women are more likely to have strokes than males.
Really? I thought it would be the other way around.
Nope. So factors that may increase a woman's risk include pregnancy, conditions during pregnancy such as preeclampsia, eclampsia, and gestational diabetes. Also the use of oral contraception, especially if combined with smoking cigarettes. And then postmenopausal hormone therapy. So all those combined kind of increase a woman's risk over a male.
And of course, prior strokes, and this is where TIA comes into play.
Yes, so a personal history, as you said, if you had a prior stroke, TIA, prior heart attack, your risk for recurring strokes increase after experiencing just one. And an individual who has experienced one or more TIAs is 10 times more likely to have a stroke over someone the same age and gender as them.
Interesting.
Yes.
Now, as we had talked about, there are manageable conditions.
Yes.
And there are quite a few of these. So I suppose that these are things that you can do something about.
Yes. So the first one we have is hypertension, and this is actually one of the leading causes of stroke. So it's very important, if you have hypertension, it's important to do a diet change, to be on medication, to really work to lower your blood pressure, because that alleviates the risk of a stroke. Some others we have is smoking cigarettes, diabetes, diet, obesity, high blood cholesterol levels, and physical inactivity. And I want to say physical inactivity can also increase the risks for not only stroke, but heart disease, obesity, hypertension, the high blood cholesterol, and diabetes. So as you can see, a lot of these factors go together. And then some other conditions, like a lot of heart conditions, atrial fibrillation, you always just want to make sure you're working with your doctor and managing your conditions to lower your risk for having a stroke.
It's good you mentioned it. Of course, it comes up in a lot of discussions we have about a lot of topics, and that is exercise and here physical inactivity and how important exercise is.
It really is. There's some things we always mention, the smoking cigarettes is no good cause of, like, that doesn't lead to anything health-wise.
Positive, correct.
Yes, positive. And physical inactivity, like, it's always good to, at least as we've said before, go for a walk. Just try to, you don't have to focus on a number of minutes of exercise, more focus on walking more and sitting less.
And as you had mentioned, it's not necessary that you try to outdo it and do too much. It really is, I think it's probably more based on consistency than anything else.
Yes, and we always mention to check in with the doctor, because maybe the exercise you choose is not right for you, and you don't want to get hurt either. You're just trying to get healthy.
Right.
So.
Next, we will look at symptoms.
Okay, so an easy acronym to remember for symptoms is FAST. So the F stands for face drooping. We also have an image that kind of just goes through this acronym. So the first one, face drooping. So you want to kind of assess whether the face is possibly numb or drooping on one side. A quick way to assess this in a patient or a person you're with is to have them smile. The second one, A, stands for arm weakness. And a quick way to assess this is to have the person raise both arms in front of them. And if they're having difficulty raising one, that might signify a stroke. And then S stands for slurred speech. So in order to assess this, it might be slurred speech. It might just be difficult to understand them. Just have them say a simple sentence such as, the sky is blue, or don't cry over spilled milk. You're just trying to assess, get them talking to assess what they sound like.
Right, right.
And then T stands for time to call 911. If you notice that a person has any one of these symptoms, call 911 right away, because it is essential, as I said, to get treatment promptly.
Now, there are some additional symptoms as well?
Yes, so the additional symptoms include sudden numbness. This can be weakness in the face, upper and lower extremities, and especially if it's on just one side of the body. Sudden confusion, sudden trouble with vision in one or both eyes, sudden trouble walking, which would include dizziness, loss of balance or coordination, and sudden severe headache without a known cause. Because this blockage happens quickly and all these symptoms will kick in right away. So that's why I really wanted to emphasize it's sudden symptoms that are going to happen.
And you mentioned one side of the body traditionally being affected?
Yes, so I actually will be going over that under the effects of stroke too.
Okay, but before we get to that, let's talk about treatment.
Treatment, yes. So as I keep saying, prompt medical evaluation is very important because you're on a time schedule with a lot of these treatments. So for an ischemic stroke, the FDA approved treatment with a tissue plasminogen activator, RTPA, also known as alteplase. Forgive me if I'm saying that wrong.
You say it better than me, I know that.
So this medication is administered IV through the individual's arm or leg, and it dissolves the clot to improve blood flow to the area of the brain that has been deprived. And this medication is known to reduce the long-term effects of stroke and can even save the individual's life. But there's only a 3-hour window to receive the dose after the onset of these stroke symptoms. There are, when I was doing my research, for some patients they say there's a 4-hour window, but it really depends on that patient themselves.
But that's still very limited.
It's still limited. So that's why I keep saying any symptoms, make sure you call 911. And then also for an ischemic stroke, they can do an endovascular procedure, which is known as a mechanical thrombectomy. And this is recommended for individuals with large vessel occlusion. And this procedure consists of threading a catheter through an artery in the groin up to the blocked artery in the brain and using a stent receiver, which is kind of like a small wired cage device, and it actually grabs the clot to remove it. And with this procedure, there is about a 6-hour window after the onset of the stroke symptoms. And then next we have for their hemorrhagic stroke, the treatment goal is to obviously stop the bleeding. And in order to stop the bleeding, they have to assess what the source is. So they'll use another endovascular procedure, and they put a catheter with it's a very small catheter with a video on it, so the surgeon's able to go up and look to see where the bleed is coming from. And then they can use a mechanical agent, such as a coil, to place it around the vessel to further stop bleeding. So it's very
intricate.
Yes.
That especially.
And they're actually, it's interesting because the recovery time's not that bad after, because they're not actually like cutting into you. They're just going through, it's like minor procedures to do this.
Yeah, they're going through an existing brain,
Yes.
an existing body avenue, I suppose.
Yes, yes. And then treatment for the brain, I just wanted to quickly mention for the brainstem stroke, recovery is possible. And this is largely because language ability is not really affected in this type of stroke. And the double vision and vertigo normally resolve several weeks after recovery. But even with this one, you still want to get prompt medical evaluation because you really don't know what's going on with you
Right.
when the symptoms start.
And you don't know the cause or any of that,
Yes.
of course.
Yes.
Now, the effects of stroke.
So as you mentioned, like one side of the body, the brain is a very complex organ. It obviously controls the entire body.
Not mine.
Yeah. But so the effects depend on the location of the obstruction and the extent of tissue affected. So the quicker it's resolved, the better, obviously. And it is important to note that one side of the brain controls the opposite side of the body. So therefore, like if the left side of the brain was affected, we may see paralysis on the right side of the body, speech and language problems, and slow, cautious behavioral style and memory loss. Whereas if the right side of the brain was affected, we may see paralysis of the left side, vision problems, quick behavioral styles, and also memory loss with that. It's also, so post-stroke, an individual can benefit from physical therapy, speech therapy, and even behavioral therapy to cope with the emotional effects. Because if someone was a healthy individual and then had a stroke and was no longer able to take care of themselves due to paralysis, it really weighs on you emotionally.
And I would imagine, and is it not, so is there potential for repair but not extensive repair?
So it depends on how much you've been affected, obviously. You do see recovery in a lot of these patients, but it really it's hard to say because it depends on the extent to which they have suffered.
Right. So looking at prevention, anything that we can do to prevent a stroke is, I believe, top priority.
Obviously, with any condition, prevention is always the main one we like to focus on. So if you looked at all the risk factors I mentioned, lowering your blood pressure is very important. Weight loss, increasing exercise.
Which we should mention that increased exercise almost takes care of the two above, the weight loss and lower blood pressure, at least to some degree.
Yes. And so weight loss, increased exercise, and you also want to focus on your diet because if you're eating a lot of fatty foods, you're going to gain weight. If you're intaking a lot of sodium, your blood pressure is going to go up. So it's a lot of these intertwine and go with one another. So with the increased exercise, they say to aim for 150 minutes a week. But as I said, don't focus on those minutes. Focus on just walking more and sitting less if you can. They also say if you do drink alcohol, drink it in moderation because if that can also lead to hypertension if you are drinking too much. And then manage current conditions such as diabetes, atrial fibrillation, or any other heart conditions. Quit smoking is a very big one. And then also know the warning signs. You may be able to help yourself or help someone around you.
So watch this program.
So watch the program. Yes.
Right. One of the thoughts I had just had, as far as lifestyle changes, exercising, something as simple as taking your lunch hour and going for a walk is beneficial.
It really is because you don't, especially if you work in a desk job, you don't realize, like you're not able to get up and move around as much. So even if you take a mental note, sometimes if you just set a timer on your phone to get up every 30 minutes and do a quick walk around the office, any little change is really going to help benefit you.
A coworker of mine has a Fitbit, which tells her to get up and walk,
Yes.
periodically during the day. So Something like that.
Something like that. But even the old-fashioned, just even put a Post-it note just saying,
Okay.
get up and walk, just to kind of get it in your brain and work towards having a little healthier lifestyle.
Right, right. Well, I want to thank you for coming in. We should mention to the folks at home if they have any question about any of the topics that you discuss here in this program, or have suggestions for a topic that we haven't talked about, they are welcome rather to call the health department.
Yes, because I know before me, Ruth had covered a vast majority of subjects.
You can get there too.
Yeah, so whether they want something, maybe updated information, or if they just want more information on it, I would love to get some ideas on shows people would like to see.
And the best number to reach you at?
So my phone number, direct line, is 617-376-1286.
And of course, the City of Quincy has a website. The health department does have a link on that site, which is quincyma.gov.
Yes, and my email is also on there too, so you can feel free to send me an email.
And I guess we will see you back on a different day with a different topic.
Yes.
Great.
Right.
Thanks for joining us.
Thank you.
And thank you at home for watching. You have been watching a program of Quincy Access Television and the Quincy Health Department. Please continue to watch QATV for more locally produced programming.